Let's go.
Laparoscopic Cholecystectomy. So what does that mean? Or it's also called lap chole. Lapar, first part of this means abdominal wall. Second part, scopic, means you're going to be viewing with a scope. You already use that word in telescope, microscope. So this is laparoscopic. You're using a scope or you're viewing the inside of the abdomen, usually with a scope and a camera, kind of like you'd watch it on a TV screen. Cholecystectomy, what does that mean? Chole is bile. Cyst is a sac or a bladder, is something that holds something. And your ectomy is removing. So you're removing the sac that holds your bile, which is gallbladder. So what is bile? What's it used for? What's it mean to remove the sac that holds it? Your liver produces bile. It's like a green liquid stuff that helps break down fatty foods. So when you eat fatty foods, your liver produces bile, it comes down your hepatic duct. Remember that HEPA, like hepatitis, HEPA means liver. This is your hepatic duct. It goes into your cystic duct. Remember, cyst means sac, so this is the duct or like the little vessel that runs over to the sac. So this will store your bile in here. When you eat fatty foods, it goes down your stomach, passes through your small intestines. Your body says, oh, we need to break down these fatty foods. Pushes the bile down your common bile duct and out into your duodenum where it can help break down your fatty foods. Common bile duct, this is the duct that both of these have in common. That's how I remember that. So you're going to cut the storage off here. You remove the gallbladder, you've got no storage now. Your liver will still produce bile. It'll come down your common bile duct. You'll have more of a drip. You'll have more flow of bile. Whenever they do a cholangiogram, you're going to be shooting dye, like IsoView, this way. You should see the dye come up this way on your X-ray, and it'll branch out into like a little root system. It'll look like roots of a tree up here. And you'll also see it go down, and it'll look like it's running into a river, which is where it's going into your small bowel here. So it'll look like it'll light this up on your X-ray. That shows that you have clamped here instead of here, to make sure that you're clamping it in the right place, and to check for stones. If you have a stone in here, it can obstruct the bile that comes down, can clog up that system, and cause you a lot of problems. So you're also checking for stones when you do a cholangiogram and shoot that dye and take the X-ray. If you're a surgical tech, you take a gallbladder out, feel it, see if there's any stones in there. You'll be able to feel them. They feel like little marbles. Some of them can get pretty big. Learn these things, learn how to break down your medical terminology, learn what it is you're doing in the surgery, how it works, why you're doing it. Learn all these things. Don't just scrub in, stand out.